Dennis, we're hearing a term, healthcare reform, and you turn on the TV pretty much every day in the news. Where is Hardin Memorial Health actually aligning with healthcare reform? Where do we see us going?
You can't get away from it, can you? You see it everywhere, on the radio and on TV and newspaper. Yes, I mean, obviously we all know the health reform train has already left the station and is steaming down the track. The specifics of that, though, have not yet been worked out. There have been many draft proposals on both sides of the aisle in Washington, and obviously the president has his proposed reform package and how that might look. I don't think any of us really know what that's going to look like specifically, but health reform will really include these basic measures. It's going to be improving outcomes and reducing cost. Those are the two. When you boil everything down and you boil down every proposal that's out there, it's going to be about improving outcomes, or improving health status of not just individuals but the communities as well, and doing that while reducing the cost of health care. So with regards to those two initiatives, Hardin Memorial is very well positioned. We are one of the lowest cost providers in the whole Commonwealth, and the other way that we are positioned is with our partnerships with these physicians. One of the things you may have heard about with health reform is bundled payments, where there will be one payment to a health system, and then that system divides the pie up from all the different stakeholders, physicians, and all the pieces of the continuum, whether it's an inpatient stay or an outpatient visit or long-term care, whatever it may be. And so we are very well positioned. The other way that Hardin is positioned is that we're part of a larger system, Baptist healthcare system, which is one of the largest and best positioned healthcare systems throughout the whole Commonwealth, and our 7 hospitals. So Hardin, in our community, we are very well positioned to tackle health reform, whatever it may look like. So.
Well, I heard you use the term outcomes. So if I'm a patient at home getting ready to come into the hospital,
yes.
What actually does an outcome mean? I understand that I have to have the quality of care in the most efficient way, but also I need to take some responsibility for my own health. So expand
Absolutely.
a little bit about what an outcome term means.
Sure, and that's a fancy term that we use that basically means that we want you to have the best experience both before a hospital stay or before a hospital interaction and after, to get you back to functioning as well, if not better, than you were before. So it's doing all of those things prior to a visit, whether that might be a pre-service phone call, it might be going through pre-admission testing where we are equipping you with what's going to happen so that we're managing your expectations on your stay and how you're going to be treated and what you need to expect both before, during, and after. The biggest part of outcomes management has to do on the back end of a hospital stay, and this is where our partnership with our physicians comes into play, where we are doing a better job, especially for those chronic disease processes such as diabetes or hypertension or some of those chronic issues that folks have. We want to keep you out of the hospital. If we can keep you well and healthy and out of the hospital by working with our physicians, both primary care physicians and specialists, that's what we want to do. And we want to check up on you after a hospital stay or after a surgery or whatever the event is, whatever the episode of care is, so that we're helping you take your medications, live the healthy lifestyle that we need to do to have that good health outcome. And you talked about personal responsibility. That is part of it. Part of what you're going to see even in the health reform and whatever version might get passed, you're going to see more onus on individuals taking more responsibility for their individual health status, and that hits a little too close to home for all of us because all of us we like to indulge every now
Absolutely.
and then, so, and me included. So
I think it's really, a partnership, and we're really getting back to being a wise healthcare consumer and empowering the patient and the physician, the healthcare system partnership, and making sure that everyone knows what the expectations are, what you need to do, and being informed.
That's right.
Of what's going to take place and what you need to do in order to have that be the best, that you get back to the enhanced quality of life that you need.
No question. The most important partner in this healthcare process is the patient. Mm-hmm. The patient has a lot of control, and that's not always been the case. I mean, that's really just evolved here in the last 10 or 15 years. I mean, historically, in the old days, it was the physician in the hospital knew best, and we're going to take care of you, and you don't need to know everything we're doing to you. But that's gone out over the past couple of decades, and now the patient is the biggest and most important partner in the healthcare process.
And I think you're seeing the patients being encouraged to be prepared for a visit, so that they can ask questions.
Right.
And on the other end, you're seeing the physicians, ready to give that information and share that with them. And do you have any questions? And how can we, make sure you're ready to go?
Absolutely. That is the key. We want to meet and exceed the expectations of the patients and their families. Mm-hmm. And that starts before an episode of care and continues all the way through until you are back better than you were before.
Absolutely. As we wrap up today, Dennis, where do you see Hardin Memorial Health maybe in 5 to 10 years?
We will be one of the top, we already are well on our way to one of the top hospitals in the Commonwealth. We're going to be one of the top hospitals in the country. This hospital is well positioned. We have excellent staff. We have excellent physicians. We're adding to those numbers every single day. We are supported by our board of directors and Judge Berry, our board chair in the fiscal court, and this community. This community is a wonderful community, and we support our hospital. We were just named. We got an award from the National Research Corporation. It was a hospital choice award, and we were one of only 3 hospitals in the Commonwealth that. It was a public opinion of how the hospital functions, and so our community thinks very highly of us and supports us, but we've got to give back and support the community, and that's what we're trying to do.
Excellent. I think those are great points, because many of our services, and all I should say, are striving for national standards and meeting those, and partnering, of course, with national organizations too, to make sure our quality of care is always the best. Well, we thank you for taking this time out of your busy schedule to share with the community what's going on with Hardin Memorial Health. For more information, we encourage you to go to our website, www.hmh.net, to find out information about our services, physicians in the area, and also some health information. We hope you tune in next month for another important edition of Health in the Heartland.